Thank you very much. My question is to the Premier. When Michal Kaliszan, a resident of Waterloo Region, was diagnosed with spinal muscular atrophy, doctors told him he had the life expectancy of 16 years. But he's now 39 years old. Michael has beaten the odds thanks to the round-the-clock care from his parents. But with no family left to care for him and the lightning-fast passage of Bill 7, Michael says without funding for a comprehensive home care program, the province will likely place him in a long-term care home, which he says, and I quote, will be his death sentence. He is desperately trying to preserve his autonomy and his self-determination. This is a serious gap in our healthcare system. Mr. Speaker, can the government explain why they think it's appropriate for a 39-year-old man to be forced to live in a facility that primarily serves seniors?
Minister of Health.
Thank you, Speaker. You know, I have to say, and well done to Michael and his family for beating the odds. It is an amazing story of resiliency. But I have to ask, have you told Michael that you voted against $1 billion investment in home care? $1 billion that we're putting into community care, that we're making sure that individuals like Michael who want to live in their home with support have that option available to them. With the greatest of respect, Speaker, when you vote against those kinds of investments, it sends a very different message to your constituents that you do not believe in community care. You do not believe that we need, as a province, to expand home care services in the province of Ontario. Clearly, we do. Our government has made that commitment. We've made that investment. Why isn't the member opposite lauding that and talking about how that is going to make a difference in the lives of her constituents, including—
Thank you. I'll remind members to make their comments through the chair. Supplementary question.
Thank you, Mr. Speaker. Well, that is as low as it gets in this place.
You got it.
Michael's mother is now in palliative care, and he says the GoFundMe program to raise money for his home care is, and I quote, the only way that I can help my mom find peace, as she's more worried about me than her own death. Michael is semi-independent. He can work and has a life that is not defined by his disability. The care he receives should be reflective of that. But with no serious investment in a comprehensive home care program, because the gap is there and the minister knows that, institutional care is looking more and more like the warehousing of vulnerable people like Michael. That is the system that you are overseeing, Minister. So does this minister believe that this is the right care at the right time, at the right place, like the long-term care minister said yesterday, because Michael doesn't, and either do we?
Minister of Health.
Thank you, Speaker. I want to highlight what this actually means in terms of an investment. 739,000 nursing visits, 157,000 nursing shift hours, 117,000 therapy visits, including physiotherapy, occupational therapy, and speech-language pathology, 2,118,000 hours of personal support services, 236,000 other types of home care visits. This is real, Speaker. This makes a huge difference to individuals who want to stay safely in their own homes with some support. This is the support that we need in our sector. This is how we are going to get a healthcare system that ensures no matter where you are, in hospital, in long-term care, in your own home, in palliative care, we will have the support available to support you through that journey. Thank you.